Public health is the science of protecting as well as improving the health of individuals in a community through the promotion of an active and healthy lifestyle, research for disease, and detection and control of infectious diseases. It focuses on the big picture, not the individual level. Its scope is the population as a whole, either a local, neighborhood, or even the whole country. Public health professionals try and prevent problems in the community by creating educational programs to teach people about the true meaning of public health and how to live and coincide in a safe and healthy environment. Many people have a skewed view of what public health actually is.
I think that public health is everybody not being overweight and eating properly, maybe restaurants offering you really good food and healthy food.
Just acknowledging what you put in your body and how you take care of your body.
Public health is the health of the public.
Is that it?
Yeah.
Public health is like general health. Public health is it's like the well-being of everyone. Public health is safe sex.
Public health is not smoking cigarettes because lung cancer.
Yeah.
What's the right answer?
Public health is the general health of all of the public.
That's what I was. Wait,
It's the well-being of everyone in the world. Yeah. That's about it.
I don't know.
The general ignorance towards it, the abstract nature that it may hold, and mostly just common confusion and uncertainty of what public health actually is. There is a broad selection of professional fields in both public and environmental health, all from state to private jobs. Environmental health can be considered a branch of public health, although a very important one. It is concerned with all aspects of the natural environment as well as a man-made environment that may affect the health of individuals. Environmental health deals with the relationships between the natural world and its inhabitants.
Physical environmental health encompasses both the built environment and the natural environment, both of which interact greatly. Natural environmental factors include air and water quality, noise levels, and green space, while the built environment consists of houses, workplaces, and other buildings, as well as any public infrastructure such as transport systems, roads, waterways, and other engineered systems. Some of the health concerns related to physical and environmental health stem from dangerous workplaces and unsafe public spaces, both of which can lead to injury or death. Lack of public transportation can also hinder people in a socioeconomic sense in terms of lack of access to work and healthy food sources. A lack of access to healthy food is called a food desert and leads to poor nutrition.
Nutrition can lead to negative health effects such as obesity, hypertension, high cholesterol, heart disease, diabetes, stroke, and many others. Access to healthcare impacts physical, social, and mental status and helps prevent and detect serious health conditions to increase the quality of life. This primary preventive measure of substandard housing prevents diseases and accidental injuries to promote overall health and safety. Housing improvements also conserve energy and prevent homelessness. Socioeconomic factors that influence health and well-being include the unavailability of jobs, inadequate nutrition, access to affordable, quality healthcare, and substandard housing. To environmental health include education. Educating people on the different factors of environmental health, such as harmful chemicals and biological diseases, and physical and socioeconomic factors include providing healthy food options to low-income neighborhoods, such as farmers markets and nearby grocery stores, providing signs near bodies of water addressing pollution problems in water, and providing awareness of inequality in the United States through classes and seminars.
Chemical threat agents are poisonous vapors, aerosols, liquids, or solids that have toxic effects on people. These chemicals can be naturally occurring in the environment or synthetically produced and released. Early detection and accurate identification, usually by the CDC, are critical to enable effective treatment and prevent additional exposures. A CDC will do rapid toxic screen tests, which are used to identify chemicals and the amount of exposure a person has experienced. Biomonitoring program provides info and human health effects, surveillance data, and additional learning resources for each chemical.
Woo! Not to fret. The CDC Chemical Emergency Response Team will be to the rescue. The CDC has things like the Chemical Emergency Response Team to react to things like chemical spills, as well as the Laboratory Response Network for chemical threats in case of chemical terrorism or other chemical emergencies.
Improper disposal of waste, specifically chemical waste, can lead to toxins being released into the environment, which is why the Toxic Substance Act was put into action. Plastic waste is also a significant problem because it causes pollution to the environment, specifically the oceans, and the chemicals in the plastic leach out into the water, contaminating it and its inhabitants. Pollution Prevention Act helps to control industrial waste at its source. As you can see, smoking also leads to pollution because people don't properly dispose of their cigarettes. It also leads to a release of chemicals into the environment, which has adverse effects on the smoker as well as anyone around them. Combustion of coal, fossil fuels, and liquid petroleum releases chemicals like carbon dioxide, carbon monoxide, and sulfur dioxide, as well as other greenhouse gases. This leads to climate change as well as an impact on the health of the public. These chemicals lead to an increased risk of asthma, bronchitis, lung disease, and morbidity and mortality from cardiopulmonary disease. A solution to this problem could be reducing dependence on cars by using bikes or public transportation. Drinking water is monitored for chemicals, specifically arsenic, fluoride, selenium, iron, magnesium, and possibly aluminum, and these regulations are set by the FDA. Global Environmental Monitoring System analyzes level and trends of contaminants in food to prevent exposure.
Common diseases found in food include the neurovirus, which is a contagious virus that causes inflammation of the stomach or intestines, and the symptoms include stomach pain, nausea, body aches, and fever. Another common disease is salmonella, which causes diarrhea, fever, and abdominal cramps. There are many public health measures in dealing with biological factors of environmental health. These measures include prevention, such as water testing, bug spray for mosquito transmitted diseases, health inspections, and education. They also do surveillance to monitor outbreaks, and they administer vaccines and antibiotics when a disease occurs.
Peace, love, save the public health.